Hi guys, my name's Ciara. I'm a cosmetic injector from Melbourne, Australia. Today we are going to be doing some injecting for you. We are going to be doing 4 models and first up today we have Thea. We're going to be doing some anti-wrinkle on her today. So Thea, tell us a bit about yourself. How old are you?
I'm 28.
28, and you've had anti-wrinkle before?
I have, yeah.
Yes, and did you like it?
Loved it.
Okay. And how long ago has it been since you've had it?
Been a year.
Okay. So ideally with anti-wrinkle, you want to be doing it every 3 to 4 months. It means that you maintain your treatments instead of starting from scratch and having to do things, start all over again and do a really high dose all over again. If you maintain it, your muscles will definitely atrophy and stay a little bit smaller and they won't be moving as much. So it's much easier to maintain than it is to start all over again. All right, so for Thea today, we're going to do her upper face anti-wrinkle. We're also going to do a little bit of the lower face anti-wrinkle. So I'm going to mark her up. I do this with all my clients to make sure I can see where the muscles are and work out my dosing. So first of all, I'm going to look at Thea's face overall. She has a little bit more width in her lower third, right, just around here. And if you can see that, she's just a little bit wider throughout here than what she is through her upper face. And one thing that we can do to reduce this bulk is use anti-wrinkle to try and slim that muscle down. There's a very big muscle there called the masseter muscle. And if we go in and we relax it, it can shrink and atrophy and create a slimmer aesthetic. Ideally, beauty standards move towards V's. So if you're looking at someone and you're trying to maintain youth, what you want to do is have the width in the cheekbones. And as you come down, it tapers down into a V shape. So that's sometimes what you're working towards depending on the aesthetic that you're going for, but overall, that's kind of what you're looking for. With Thea, she's actually wider in her lower third than she is in her cheekbones. So we want to try and manipulate that and create a little bit more width in her upper third and reduce the width in her lower third down here. So first of all, I'm going to look at her and I'm going to get her to bite down on this, so bite down really hard, good, and relax, and bite down again. I can feel this muscle, it is very big and it is very strong. So sometimes it takes 2 rounds of treatments to get that muscle to relax. Now we're gonna look at her upper face. So, if we look in the camera, big frown for me, good. This muscle here is the glabellar complex and it's made up of essentially 2 to 3 muscles. There's the procerus muscle, which pulls down, and then there's the 2 corrugator muscles which pull in. So this is a depressor muscle as a whole, and when you put the anti-wrinkle in there, it's going to relax that muscle being able to pull down, which means you can get a little bit of elevation in that mid part of the face there, or the, not the mid part, what would you say? In the eyebrow. So, big frown for me, good, and relax. That's the procerus, then a big frown for me again. Then you have these 2 muscles on the side and they're the corrugators. They pull in. We want to relax them as well. Thea has quite a small corrugator, so we don't need to go too wide with her in relaxing that muscle. As you can see, the bulk of hers is just here. She doesn't pull too much on the lateral parts of the tail of the brow there, so I probably won't even go that wide. Good. Okay, we're going to mark up her forehead. Thea's slightly heavy in her lids. The forehead is the frontalis, the only elevator of the upper face. As soon as you put anti-wrinkle into that muscle, it's going to not be able to move, and that means that sometimes the brows can sit a little bit lower. I personally prefer a flatter brow, but some people prefer a more arched brows, it's more feminine, and there are ways to manipulate the brow, the look of the brow, the aesthetic of the brow. What do you prefer? Do you prefer a straighter brow, or do you want a little bit more of an opening on the lateral part of your brow?
I think I need opening, don't I?
Yeah, okay.
Yeah. Do I?
Yeah, we can do a little bit. All right, so this muscle pulls up. So lift up for me, Thea, as high as you can. See how this muscle pulls up here? We've got to work out where we want to place our anti-wrinkle. She doesn't have much movement in the high part of her forehead. It's really concentrated just here. So relax for me, lift up again. Good, tiny bit there, relax. Lift up again, and tiny bit there, good. Up. That will be fine. What I normally do is do a low dose at the start, and then what I'll do is get Thea back in 2 weeks, and I can always touch up. much easier to add product than it is to take it away. Smile. We're gonna do around Thea's eyes as well. So this muscle is like a sphincter called orbicularis oris, and it pulls in as well. So if you scrunch up your eyes like this, you can see that muscle pulling all the way around. What we want to do is stop that muscle being able to pull in as much. What that does is opens up the eye a little bit. It can give you a little bit of a lateral brow lift, not much, maybe 1 to 3 millimeters, very small amount. But we can open up the eye area a little bit. It looks nice in combination with the frown and the forehead. Big smile. Thea doesn't need a lot. I'm only going to do a very small amount. Squeeze your eyes nice and tight. I'm also going to have a look at her lower third as well. So there's a muscle here that pulls up, and that's called your mentalis. It generally contributes to that pebbled sort of appearance in the chin, or that cauliflower appearance. So it's one of those areas that you're not going to notice too much on yourself being changed. But when someone is looking at you and looking at your face as a whole, if the upper part of your face isn't moving, the lower part is, it's going to be incredibly distracting, and it looks a little bit off. So it's really important when you have treatments done that you not only look at the upper part of the face, but also the lower part of the face. So pop your bottom lip out for me. Good. This is the pebbling I'm talking about here. Okay, relax. Good. And now pull the corners of your mouth down like this. Good. And relax. Good. All right, that's Thea all marked up. I'm going to get all my anti-wrinkle ready and we'll start injecting. Okay, so we've got Thea back ready to be injected now. She's already been cleaned. Okay, here we go. Sometimes the chin will need a couple of goes. So, because it's a very strong muscle and you can only put a low dose in it because you don't want the product to diffuse, you have to do a low dose and you have to do it again sometime. So we're doing her orbicularis oculi at the moment, so that's the muscle that pulls in. Remember, around the eye to open it up. Big smile. She doesn't have a lot of movement, but I'm just softening. I'm not doing a high dose at all. Trying to do the little part, the lateral part of the eyebrow. We'll kick up the brow a little bit. Big smile. Okay, we're gonna do her frontalis muscle now. This is by far the trickiest muscle to get perfect. A small amount of product can make a big difference and a big impact. So you want to go on the lower side of things and then get them back in 2 weeks, check, and if you need to add more product, you can. There's nothing worse than when a client will come back and they feel heavy, they feel like they can't lift their brows, they don't like it. Because I've done Thea before, I'm happy to do a little bit higher than what I would do is if she were a new client, I wouldn't go this high. I'm now going to do Thea's lip flip. So this is a treatment that you either love or you find doesn't do too much for you. There's a muscle that goes all around the mouth and it's called the orbicularis oris. It's the same or a similar muscle as what's around the eye. It's like a sphincter and it pulls in and down. Sorry, in. So when you're smiling, if you find that your upper lip tucks under and you're not getting as much lip show, you can relax the muscle slightly and that will give you more lip show because the muscle is not able to pull under as much. It hurts a little bit. So.
Didn't numb me first.
No, sorry. Big kiss. It's quick. Big kiss. And relax. This is also a very light treatment. You only do very small doses. Okay, we're going to do Thea's masseters now. One thing we have to be careful with when doing the masseters is that we need to keep the injections right in the muscle, and the muscle is quite deep. If the product diffuses into a muscle we don't want it to, can cause asymmetries in the smile. There's a muscle that helps elevate the corners of the mouth. If it gets knocked, it's going to throw out those muscles and you're going to have an asymmetric smile. So something to be mindful of. It's one of the risk factors in this area, okay? All right, so what I want you to do is bite down really hard, okay? Good girl. Feel for the muscle and keep biting down. I'm going to start injecting, okay? 1, 2, 3. Keep biting down, good girl. This muscle will start to relax over the next 2 weeks when the product starts to activate. But this muscle needs to atrophy. So we need to get this muscle nice and small. That's when you start noticing the slimming effect in the face. Takes a good 6 to 8 weeks. And sometimes it can take 2 rounds of the treatment to get the muscle to really atrophy and get very small and get that facial slimming. The reduction in grinding and that tension will reduce within that 2 weeks, but the best results come at the 6 to 8 week mark. You can often feel how tight the muscle is and how strong it is. Feels like you're sort of pushing through like really tight tissue, almost, that's how it feels. That's Thea done. Well, her anti-wrinkle is going to take 2 weeks. I'll review her in 2 weeks and we'll see whether we need to do any touch-ups. Sometimes we do in the forehead, everywhere else is usually very straightforward. So, how was that out of 10?
It was fun.
That's it. It's a very straightforward and quick treatment, and the results are always fantastic with anti-wrinkle. Everyone always loves them.